Let's talk about kind of the evolution of healthcare and all the exciting things that are happening. Can you walk us through some of the most recent changes in healthcare?
Yeah, sounds good, Matt. So we've seen advancements with a whole range of medical devices, infusion pumps that are within the hospital that have been upgraded to be less static, so that instead of being static devices that were never intended to be upgraded, but to have retrofit kits available so they can be updated, so that they can be maintained better than they used to be. We've also seen examples of ecosystems with neuromodulation equipment that would be online, so the physician can interact with the patient and look in real time at the patient and then make adjustments to those. Pacemakers also as well, interaction with apps on mobile phones, gathering patient data in real time so that physicians can be informed and make adjustments to patient care in real time.
And how are HDOs, or healthcare delivery organizations, how are they reacting to this tidal wave of change? Have they been able to manage the security part of this, or are they trying to catch up as well?
So when we talk to health delivery organizations, we talk about how we're working with med devices that will be able to be updated and can be patched securely. It's like a welcome sign of relief. And then the next question is, but what about the devices that I have in our population today? And when we talk about, well, we're working with med device manufacturers that are not only developing new products to do that, but also working with current products and be able to patch the current fleet of infusion pumps out there. They're happy to hear that as well.
And are the medical device manufacturers trying to address the problem at time of manufacture now, or is this more post-market changes? It sounds like it would be
That's an excellent
best
question.
at time of manufacture.
It is. Every device manufacturer that we're working with that's designing new devices is building in patch management and updatability from the ground up. But we're also working with a number of device manufacturers that are providing updates to the current fleet so that they can have the same benefits as new devices. And it's not just technology for technology's sake. It's really centered around patient care and bettering of patient care.
You talk about best practices. What are some best practices that a typical IT group within a healthcare delivery organization or an acute care hospital, what are some things that you've seen that changes that are being made to embrace all of these opportunities?
Yeah, good question. So we ask, when we look at work with our medical device clients, we talk about 5 tenets of device security. One is to have individual credentials on every device. Another one is to provide secure storage on that device so that keys and sensitive material are stored in an area that can't be broken into. We talk about having defense in depth through separation of what's called roots of trust. Firmware and software signing, so that authenticity of the firmware that's loaded onto the device can be checked. And then the last part is patch management and update. And if you pull all those things together, and those work very well for device manufacturers, but they also work well for hospital systems. And then IT has been very good about doing this for a long time. They've known the benefits of patch management, especially for their servers, their firewalls, their laptops, and now they're starting to put in programs for the device pool that are within the hospital themselves.
And I would think even from the doctor-patient relationship, we're probably talking about eliminating or reducing a significant number of used to be office visits. Is that accurate?
Yes, we can absolutely see that coming. And almost every medical device product that we've been involved with there's a level of interactiveness between the physician and the patient that can be performed remotely.
So let me see if I have it straight. Better care, lower cost, more protection for the patient. Sounds like a real win-win-win for everybody.
It is a win-win-win.